We've been talking about oral thrush, and so now we're going to talk about the treatment. What can we do for our patients to help get on top of this oral thrush that can really inhibit a good quality of life? Okay, what can we do for it? So we want to get our patient back to eating and drinking comfortably. Oral thrush is usually treated with an antifungal medication, and this can come in the form of a lozenge, a tablet, a trochanter we call it, or a liquid to swish in the mouth and swallow or spit out. We often use a swish and spit or swish and swallow medication mixture, and we call it miracle mouthwash or magic mouthwash, and generally your pharmacy can mix it up to your specifications. Remember, this does require the order of your provider, so of course you will have been discussing this problem with your hospice medical provider. You've got a new order, and there we go. The solution usually contains some sort of an antifungal medication, and that's often nystatin. It can contain nystatin or another form of an antifungal medication, and then sometimes a 2% lidocaine gel or liquid, and that helps numb the pain in the mouth. Mylanta is sometimes included, and that's really soothing to tissues and the swallow, and even Benadryl might be added to decrease inflammation. So it's up to you and the pharmacist and your medical provider to decide what mix will be compounded for your patient. You know, one unfortunate feature of using this swish type treatment is that it requires a patient to do this 4 to 5, 6 times a day even to really get on top of the infection. And that is just often not very realistic to our hospice patients who are debilitated and weak. They may not be able to tolerate the taste, or they may not even have any energy to do this many times a day. Generally, the process is just too difficult. So what is the process? You take 1 to 2 teaspoons, swish it around in the mouth, and spit it out. But if the patient has an extension of their thrush into the throat, they may have to swallow that medication also. It's really to prevent it's important to prevent the patient from drinking anything for 10 minutes. Otherwise, they're just going to wash the medication away. Let's say the patient is unable to do this process and a caregiver needs to assist. Sometimes we just use one of our sponges, we dip it in the solution and then paint it over the entire mouth, the surface of the mouth and the tongue. Again, they can't rinse it out right away. You know, if the swish and spit process doesn't work, or the patient can't tolerate the oral process, or they have a very severe case, then sometimes a systemic medication is prescribed, and that might be diflucan. Often the dose is a 100 milligram tab, and the first day 2 tabs are taken then daily for up to 14 days, depending on the severity and the patient's response. You know, of course, one of the very first things to do to improve the patient's condition is to improve their oral hygiene, brushing their teeth and their gums daily, removing those dentures and carefully cleaning them before replacing them. Remember, oral thrush is not usually a very serious infection, and generally it can be treated. You know, we want to treat it right away so we can get our patients back to the best quality of life that they can experience in their hospice on their hospice path. Please join us to find out more about the path to comfort. Get our booklet at the Hospice Care Plan and watch a lot of our videos, please, on YouTube at the Hospice Care Plan. And remember, Brenda and my motto, it is care is treatment.